Welcome back, everyone. As always, we were just browsing the AIagentstore.ai website page to find our topic for today. And, well, we found something that might actually end the absolute misery of hold music.
Yeah, nobody likes waiting 20 minutes just to reschedule a simple doctor's appointment. I mean, it's just the worst.
Oh, it's maddening. But the tool we're looking at today is called Paratus Health. It's a closed source voice AI healthcare agent.
Right, and it's built specifically for outpatient clinics and medical practices. The mission here isn't just to replace a receptionist. It's to completely automate the clinic experience from the absolute second you dial their phone number.
Okay, let's unpack this. Paratus Health is basically taking over all that administrative heavy lifting.
Yeah, answering calls around the clock, scheduling your appointments, and verifying your insurance.
But wait, insurance verification over the phone is notoriously messy. Like, how does an AI actually navigate that? Does it just read a robotic script?
No, not at all. It uses advanced natural language processing. So it essentially acts as a real-time data router.
Okay, so it's not just transcribing what you say.
Right, exactly. Instead of just taking a message, the AI listens, extracts the specific policy numbers or scheduling constraints, and then it queries the clinic's database instantaneously.
Oh, wow. So it's more like a hyper-efficient 24/7 digital receptionist that processes all that complex logic on the fly.
Yeah, it's actively pulling and pushing data while keeping the conversation flowing naturally.
And without ever putting you on hold.
Exactly. What's fascinating here is the broader impact this has. When you remove those incredibly time-consuming workflows from medical receptionists and clinic managers,
It fundamentally shifts how those healthcare teams operate.
yes, you're drastically reducing staff burnout while actually improving patient access.
Right, simply because the bottleneck of the phone queue is gone.
Exactly. But it goes beyond just the administration. That's where the system bridges the gap right into the clinical preparation.
Yeah, because Paratus Health actually conducts a conversational patient intake before the visit even happens.
Right. It's gathering symptoms and everything.
Hold on, though. If it's doing conversational intake, how does it know the difference between, say, a routine tension headache and something really severe, like a stroke symptom?
Well, that's a vital question. And it's exactly why this system is built with strict medical guardrails.
Oh, to immediately flag urgent concerns for a human to review.
Exactly. But for your routine intake, it just listens to your symptoms and generates structured pre-visit clinical summaries.
Right, directly into the clinic's electronic health record system. Like, it writes SOAP notes. That standard format doctors use to separate your subjective complaints from their objective observations.
Yeah, it translates a patient's rambling story about a stomachache into clean, categorized medical data.
That's wild.
And it does this with an incredibly high level of autonomy. I mean, it works completely independently, without staff intervention.
So it's acting like an AI operations layer.
Yes, it becomes a vital bridge between basic patient communication and complex medical documentation.
So what does this all mean? Basically, Paratus Health is transforming outpatient clinics by replacing those clunky generic chatbots with always-on autonomous voice and workflow automation.
Right, moving the industry away from just managing a waiting room queue to actually optimizing how care is delivered and documented.
Which brings up a really interesting thought to leave you with today. If an AI handles all your intake, gathers your symptoms, and does all the paperwork before you even arrive.
Does that actually free up the doctor to be more human and present with you in the exam room?
Exactly. Or does it make the whole healthcare experience feel, I don't know, more robotic?
That is the real tension we are going to see unfold in the waiting rooms of the future.
Something to think about next time you're subjected to that terrible hold music. Be sure to visit AIagentstore.ai to check out the tool we were discussing today, and thank you so much for rating the podcast.